Welcome to Medical Mondays, the Bay Area's only medical call-in show. Now, here's your host, Vicki Liviakis.
Hi, and welcome to Medical Monday. This week, we're talking about a special lifestyle program. It's called TakeTen. We're going to describe what that is in a moment, but first, joining us this morning is Dr. James Peters and Dr. Cheryl Thomas Peters. Both manage the TakeTen program at St. Helena Hospital. Welcome to the program, doctors.
Thank you.
Thank you.
I was able to actually attend this at least for a day, and it was fascinating. We're going to have a chance to actually look at some of the video, but before we jump into that video, the TakeTen program, why do you call it TakeTen?
Well, it has to do with 10 days. We found when we try to help people make healthy habit changes, it takes a little bit of time.
Right.
A week might not be long enough. We found 2 weeks is too long. It's hard for people to get away, but 10 days seems to be just the right amount to be able to do pre-tests, post-tests, and intervene with enough education to see real success.
Okay, so 10 is the magic number. When they first walk in, what happens?
When they first come in, that's the part where we do all of the individual assessment. So we look at their individual risk, we look at their diagnoses, medical conditions that they come to us with, but we also, they meet with our complete multidisciplinary team.
Well,
so the clinical psychologist, the full team.
And let's just go ahead and, because I was able to visit, just to get a better understanding of that TakeTen program and what it involves, let's check it out so folks can see that. Looking at the views of Napa Valley from a room at St. Helena Hospital can be inspiring. And for patients of the TakeTen program who want to feel good, well, they're not just gazing outside, they're looking inward, learning how to manage chronic disease or break addictive habits and get more satisfaction in their lives.
They've seen it, they've felt it, and they want to continue to live younger longer.
Dr. James Peters and Dr. Cheryl Thomas Peters run the TakeTen program. They're a husband-wife team, and both have extensive experience in preventing and treating chronic illness.
But the advantage is when I find things, hey, we've got the full diagnostic capabilities of a hospital with CT, MRI, and cardiology and oncology. Everything's right here.
The motto is, give us 10 days and we'll give you back your life.
This isn't a pie in the sky, you know. This is about how you're going to do it, how you're going to do this every day.
Jerry came to stop a lifetime of smoking that's damaged his heart and lungs. How long have you been smoking?
30 years.
And you're trying to undo 30 years?
I have. I'm 7 or 8 days smoke-free.
Treatments are customized and start with a series of tests and evaluations.
Good job.
During the 10 days, patients live on site and practice their new lifestyle under close supervision. They attend classes on reducing stress and practicing mindfulness.
And we'll cut it in half.
Cooking demonstrations by chefs from the nearby Culinary Institute help participants see how easy it is to cook with healthy natural ingredients that taste great and make you feel good. After a meal, there are no couch potatoes here. Rain or shine, everybody takes what they like to call an O2 cocktail.
We want our oxygen, our fresh air, out in nature, and the exercise, of course.
There's a lot of simple things in terms of health habits that can make a big difference in everybody's lives. And people can be a lot healthier. A lot of the chronic disease that we have that are the main reasons why people are dying prematurely, they don't have to do that.
Dr. James Peters has been compared to another TV doctor from the series House. His specialty is mystery illnesses and getting to the bottom of what's really going on with the person.
He loves to go after the mystery condition or mystery disease, and really, listen to all those details and really find answers. So I often say when he sees hoof prints, he looks for zebras, not just horses. And so he goes that second mile. He doesn't accept the standard answer. He looks for more and continues to dig and isn't satisfied until he finds answers.
A patient or a person is more than just the sum of body parts. How do you treat them?
They leave here feeling hope.
Yeah.
They feel hope. That's the most exciting part. Is I love week 2 of our program, even to just see the excitement, the smile, the color in the face. It's amazing when they first come in the program to when they leave, to see that energy level. Just today, our participants talking about, we feel so much energy. We feel so different. We're never going back. We never want to go back to what we were doing when we came in. They've seen it, they've felt it, and they want to continue to live younger longer.
For me, it was like, I'm choosing my life. I'm choosing life. And they tell me I look better.
When the 10 days are up, participants go home with new life skills that help them maintain their healthier lifestyle and fresh outlook. Who is an ideal candidate for the TakeTen program?
Ideal candidate would be somebody who is maybe worried well, somebody who has a new diagnosis of some chronic disease, like, hey, I have blockage in my heart, my cholesterol is high, I have diabetes, I need to lose some weight because that's an increased risk for me. Those would be the ideal candidates.
Okay, and Jerry, of course, was a smoker.
Yes.
So you have smoking cessation programs as well.
Absolutely, residential smoking cessation program that's really excellent that Jerry had participated in.
Okay.
And so
let's go to the phone lines if you don't mind. Sure. We're going to jump right in because the phone calls are really streaming in. We've got Rhonda from Oakland. Rhonda, good morning.
Yes.
You're on the air. Do you have a question for the doctors?
Yes, I'm trying to find out if this program, how does it work financially? Do you have to pay for the program, or do they take some sort of insurance?
Okay, good question. Who wants to take that one?
What's exciting about this program is it is set up with an insurance model. And so there's a program fee for the parts of the program that are not reimbursable from insurance, but essentially it's a program fee, but insurance covers, most insurances cover the medical component of the program, and then you're only responsible for co-pays and deductibles, of course, depending upon your individual plan.
So, Doctor, do you find that the insurance companies like this because it's preventive as well? It costs less in the long run if you can alleviate some of the problem?
Yeah, in the long run, we're treating cause. We're trying to help people be responsible for their own health. And we have a lot that we can do, and people don't realize that when they feel empowered, they can help lower their own blood pressure and their cholesterol and their blood sugars through simple modalities of eating and exercise and so on.
Would it also translate to fewer medications?
Absolutely.
Absolutely. And so there's definitely healthcare savings that have been shown in research for investing in preventive care.
I've got to get to some of these calls. Let's go ahead and try to get Joanne in from Pinole. Hi, Joanne. You're on the air.
Yes, hi. I had a question for the doctor. I have hepatitis C, and a lot of my issues are stress, and I think it aggravates it, and I get a lot of flu symptoms. I was wondering if this program would be good for me.
Yes, it would. There are a lot of fundamental things that we find that when we do healthy things, learn to deal with stress, and we have our psychologists, we have group, we have just, in fact, natural ways of coping and dealing with stress. Chronic diseases such as hepatitis C that you said will do better.
In that 10-day period, do you find it's important that they're actually on site, that people have a chance to, I don't know, be observed and to integrate some of this information as opposed to taking it home and then forgetting what you learned and slipping back into your bad habits?
That's what we find is so powerful, is that we're able to observe them for 10 days. We call it an intensive lifestyle medicine program.
Like ICU for lifestyle medicine.
Yes, and it's exciting because we can see, it's after breakfast each day that they tend to have this feeling of weakness. It's after lunch or after, we begin to look for patterns that they may not have even understood themselves. So we watch them very closely throughout the day, and we monitor how they feel each day, each hour, after the meal. We really monitor them very closely because we look at quality of life and their symptoms, not just my blood sugar's here, but also how they feel and their energy level.
But from that close observation, we can now suggest interventions or things that they can do to correct that, and we can see if it works.
So for the patients who, let's say, have had, the mystery disease, or their own physician hasn't been able to spot what it is that's bothering them, you might be able to observe things that, unless they're under care for that full period might get missed.
Absolutely.
It has the advantage of watching them over a long period of time and a lot of contact with physicians or other healthcare professionals, which, you know, their doctor may not have enough time in that 7, 10 minutes, 15-minute visit. And, you know, we build on all the information. We have them bring their records. We try to build on everything that they've learned so far about themselves.
Laverne from San Francisco, do you have a question for the doctors?
Yes.
Good morning.
I suffer with congestive heart failure. I have a defibrillator, and I also have hypertension. I'm on 12 pills a day, and I've gained a lot of weight. My question is, would I benefit from this program and not only losing weight, but being able to take some of the cut some of my medicines down?
Thanks, Laverne.
Yeah, well, those are very good questions. Congestive heart failure, of course, is the heart's tired, the heart's getting, working extra hard. We find that in our program, people do better. Blood pressures do come down. Weight also comes down. And obviously cholesterol comes down too. We find that in 8 days between measurements for blood tests that we do, we see cholesterols drop about 30 to 40 points. And
in 8 days?
In 8 days.
You can get that kind of response?
In 8 days. And this is just from nutrition, lifestyle intervention. And there's no side effects to that. You know, as we work with building healthy nutrition, healthy habits of living, people do better who have chronic illness like congestive heart failure. There are very specific things that can help nourish the heart better.
Is part of it, I mean, do people feel like they make so much headway in such a short time that the inspiration kind of spurs them on?
I think that's the exciting part, is that as they come and experience this program, they come in there hoping it will work for them, but a little apprehensive and afraid. But as they begin to experience it each day, we find the first few days, it's like, did I do the right thing? Did I come in? And we're doing all the assessments and we're working them through. And as they start changing the things that they're doing and moving more and eating differently, more plant-based foods, more fruits and vegetables, as they begin to do these healthy things and their body is in an environment of healing, by Thursday, Friday even of the first week, we begin to see the color change. We begin to see the smiles change. And they begin by the second week to really, really believe that they're going to be able to actually do this long term, not just during the 10 days that they're there. So the first week they really get a chance to believe it and buy into it because they've experienced it for themselves.
Well, a personal observation, when the chefs were preparing, they were preparing tacos. They were, vegetable tacos. When they were frying up the onions and the peppers and the flavors.
The aromatherapy.
Yeah, so it was all, there was low fat, there was no meat in it, but it was very fulfilling.
What's exciting is while the patients are eating, while you're eating the meal that you're doing, that you tasted, your cholesterol's coming down. It's improving blood pressure. There's research. We do evidence-based interventions. What we offer is proven in medical research to produce benefit.
I'm going to jump right into the phone lines again. We have Mimi from Burlingame with a question. Mimi, good morning.
Good morning.
You're on the air?
How are you?
Oh, we're great. How are you feeling?
I'm okay. Actually, I was diagnosed with asthma, when I was 5. So I've lived with that, and it's been difficult in adulthood. But also, too, I have fibromyalgia, and I don't know if doctors can help either one of. I'm so tired of taking medicines.
Yeah, I can imagine.
Typically, we consider those unrelated illnesses, although when you have it, there is some common things that will help both. Asthma, there's very specific things that we can do to help with that in terms of, obviously, medications, but we look at environmental control. Are there things that trigger it in your environment that you could maybe improve, from air filters to just where you're living, how you're living, covers for mattresses and pillows, cases, and so on. Also, looking at maybe are there certain foods that might trigger some of that.
We really focus on an anti-inflammatory lifestyle, and I think that's really key with fibromyalgia as well, is reducing inflammation. And so we've got significant results with reducing inflammation by 30 to 50% actually looking at the C-reactive protein markers of inflammation.
Just in the 8 days.
Just in 8 days. So I think that's key. That's going to help with reducing muscle pain, joint, the aches of joints and muscle.
We're out of time. I can't take any more of these phone calls. It's such a fascinating topic. We're going to have to, I guess, talk with you again very soon. Thanks for joining us, everybody. Have a great day. Bye-bye.
Thank you.
The information and advice given on this program is for general informational purposes only. For medical advice on the treatment of any specific ailment, the advice and services of competent medical professionals should be consulted. You should not initiate a course of treatment without consulting a doctor. The opinions expressed on the program are those of the guests and not those of Kron TV, its management, employees, or advisors.